went into hospitalist medicine with the idea that that was going to be my career. Just a few short years into that, I was very overworked, very burnt out, and I was 6 weeks pregnant when I experienced chest pain. I was like, this job is going to kill me. And so I stepped away, and lifestyle medicine really turned my life around.
I would like to hear a little bit about it, how you made that decision, how you set it up, and then what you're doing to make the concierge structure work.
You need to be able to offer more, and it is easier to do this through Vibrant because they have this Vibrant America panel where you can just pick and choose any of the things that you want, giving people what they want and providing a turnkey package where they can follow those body metrics and see their body change.
I look forward to that custom panel. I think it's an important component of any concierge structure or even beyond a concierge structure. Welcome to New Frontiers in Functional Medicine, where we're exploring the cutting edge of what's possible in health span, lifespan, and the future of personalized care. If you're a clinician who's passionate about staying on top of the latest science in functional medicine, longevity, and clinical innovation, you are in the right place. Each episode, we will deep dive with thought leaders, researchers, and clinicians who are moving the needle so you can translate emerging science into real impact for your patients. Let's get started. Vibrant Wellness combines cutting-edge science with an integral medicine approach to give you deeper answers about your health. Their innovative testing panels identify imbalances in areas like nutrition, hormones, toxins, and the gut microbiome, so you can take targeted steps towards optimal wellness. Discover the possibilities and become a provider or connect with a provider near you at vibrant-wellness.com/signup. That's vibrant-wellness.com/signup. Welcome to New Frontiers in Functional Medicine, where we are interviewing the best minds in functional medicine. And of course, today's no exception. I am here with Dr. Brooke Stubbs. She is a double board certified internal medicine and lifestyle medicine physician with a master's in nutrition from Columbia University. She's the founder of Rooted Femme, a concierge practice in Austin, where she helps women improve their health through both medicine and lifestyle. Brooke has served as a hospitalist on a bone marrow transplant unit. She's authored peer-reviewed articles and a textbook chapter, and she speaks nationally on lifestyle medicine. She's also the creator of Rooted Retreat, an annual wellness event empowering women to take a proactive approach to their health.
Brooke, it is so great to be with you. And I've just had a really nice time getting to know you over these past handful of weeks. And you've got a really interesting journey into lifestyle medicine. I think a lot of us do. And it's nice to hear our stories because they're unique. So tell me a little bit about you and where you came from and how you got here.
Yeah, well, thank you. It's been so great getting to know you too. I came from a background in internal medicine. That's what I did my residency in. That's what I trained in. And I went into hospitalist medicine with the idea that that was going to be my career path. And just a few short years into that, I was very overworked. I was very burnt out. I wasn't taking care of myself. I was a zombie at home. And I was 6 weeks pregnant with my second child when I experienced chest pain. And about this time, lifestyle medicine had been presented to me. And COVID had just started kind of being on the radar. And with the chest pain, that was really a wake-up call for me. Like, I'm not taking care of myself. This job is really not. I mean, in that same week here, we had a doctor who was in his 60s, a really, really incredible surgeon. He died of a stroke. And then another, a cardiologist in his 40s had run a marathon and then dropped and had a massive heart attack. And yeah, so it was just like, and then that coupled with having experienced some chest pain, I was like, this job is going to kill me, or my lifestyle is going to kill me. And so I stepped away. I put in my resignation that week, and lifestyle medicine really turned my life around. I implemented all of the pillars of lifestyle medicine And I felt a 180 in how I was feeling, a 180 in my lab work. My cholesterol improved, my blood pressure improved, my symptoms of anxiety, irritability, headaches, endometriosis, you know, uh, all of these things improved. And um, I just knew that this was the way I needed to go in order to. I kind of already intuitively knew too through having my master's in nutrition before medical school that we were missing something. We could save lives in real time, and it was a really inspiring work. But then the next morning, after the person who you just saved his life with a heart catheterization was eating like your bacon and your biscuits with gravy, I knew intuitively there was something more we could be doing to help people stay out of the hospital, and that just seeing those people in those snapshots, it wasn't fulfilling me in the way I am fulfilled now, truly, and in the way that my life radically changed by having a different focus and a more preventative focus. And it was like very hard once I got started and decided I was going to go this route to get people on board. But the one thing I knew that I could do was help people with fertility. And I knew that I had really great success with my fertility journey, part and parcel to the fact that I had really changed my lifestyle. And so that's where I really focused my attention early, with a virtual health focus in the pandemic, which was perfect. And then people trying to get pregnant and helping them change their lifestyle. And I've done really well with that patient's base, helping them with success through that.
Well, let's brag on you a little bit. I mean, you're 100% in your in your work with fertility patients.
Yeah. And I don't want to brag, and it's not me that does it. It's these women who do the work.
Right.
But if any woman that's signed up with me has gotten pregnant, and it's been
Incredible.
such a joy, and it's been such a profound part of what the work that I do. But it extends to people like just today. I have this sweet, beautiful young mother come in who you can tell her mom has autoimmune disease, and she's just presenting. Like, you just know these little red flags that are presenting or leading her down that path. And I know from the work that I've done on other people with autoimmune disease, these lifestyle factors can help to put all those symptoms at bay. And it's incredible that the way that I felt for 35 years in the lifestyle I was leading.
Yeah.
And like the amount of energy I had, I can't even imagine walking through life like that. And now the energy that I feel, and I didn't even know how good I could feel till I made that transition. And I wanted that for other women. And then as women, we make a lot of the health decisions in our, community and in our families. And so that trickles into husbands and children and parents and siblings.
It's just such a beautiful and powerful journey. And it's especially amazing when you come from this place of such deep experience, which is your own fertility journey, and the fact that you were able to miraculously turn that around. And now you're a mom of how many kids?
I have two.
You have two. Okay. So congratulations, and what a gift. And I'm sure that your own story and your willingness to be open with that really creates a safe space, and just all that really, the essential ingredients of this type of medicine. That honesty, the support, the community, knowing what to do.
Yeah.
And to the other pieces I want to underline is the ripple effect of this medicine, that it does. When one of our patients improves, responds, and embraces what we're doing, they take that forward. And a lot of times, the women are in charge of that, of the health and wellness in their family.
Yeah. I mean, I think one of my patients was like, she cheekily will say like, "Oh yes, I'm back in the place of magical healing and happiness." Like, she just always feels good when she comes in, when she lays. It's just like, there's always something, whether it's just the empathy from one of us,
Yes.
providers,
Yes.
or community here, or something that we're doing in order to give her hope, or just like recentering her focus, and I think that's medicine in of itself, and I think that it's okay.
It is.
Traditional.
Yes. And we're going to circle back at the end, because I do want to hear you're doing some pretty cool give back work as well. And I want you to talk about that. So listen, it's huge courage. So many of us have done this, transitioned from the conventional care model into something extraordinary. I am a naturopathic physician by training, so I was in this space from the get-go. I didn't have to take that same kind of leap that really feels terrifying. When I listen to your story, or there's an MD in my office who similarly had that, that come to Jesus moment where he had to leave. He's an internal medicine physician also, and needed to take the leap and did it. And it's such courage. And you actually opened your own concierge practice. And you and I were talking offline about that as well, how I admire it, and how, we're still many years into the journey wanting to make the leap over to that. So I would like to hear a little bit about it, how you set up, how you made that decision, how you set it up. And then we'll talk about some of the nuts and bolts and, what you're doing to make the concierge structure work.
Yeah. So I think that the really important thing is when you set up a concierge, there's a couple of ways to think about it. And as a solo provider, I had to be very clear with my patients, like, this isn't going to be the concierge doctor that you call in the middle of the night. If it's an emergency, you're up in the middle of the night, you have to go to the emergency room. I don't have emergency imaging, I don't have emergency, tools. And so that is one of the things that we just set patients up for, that expectation.
Perfect. Yeah.
And with that expectation, they understand. And
yes,
they're very happy that I I provide for same day appointments. So the way I set that up is anybody can book with me online. They can request an appointment online, and then we have to call to book. But then I leave some time open that you can't request an appointment. And that's just for my concierge member if they need to get in same day, if it's an emergency type situation. And a lot of time that looks like, I'm going out of town, I need to be seen, or I think I have an infection and I want to I'm supposed to be going to see my 90-year-old mother and I don't want to spread COVID to her and I want to get a test or something like that. And so that's an easy way to kind of put boundaries around things. When I started, it was slow. I think anybody who's in primary care is going to have an easier time making the transition because I was in hospitalist medicine. I didn't take anybody with me. So I think having that in mind and having enough in reserve where you can ramp up is really
yes.
Word of mouth is key. You want to, I think our business has ramped up when I had a better location, so that's important. I think having brick and mortar and it not being 100% virtual was really important for my demographic. Although I know that virtual is very, it's great to be remote, to be able to have that flexibility. And I know that there's a market for that too. I do most of what I do in person. And I will say, and I think when you set your prices, like know what you want to make and know how much you want to work and set that price. And the people will come. It may take some time, but people will come. I would get so nervous that nobody was coming that I'd lower my price. And I think if I had to do it again, I would have never done that. I lowered it, and now I'm ramping it back up.
Right.
So I think that kind of doing that reverse engineering in terms of what the salary is you want to make and how much you want to work. And I would also say, like, just, for just longevity and for preventative health, really put boundaries on the amount of time you're in work and the amount of times that you take breaks from work and the amount of time that you're home, and really put it away what you can. That being said, I need a lot of staff to be able to do this. So like, yes. I see patients all day. I'm back to back from like 9:30 until 4. And I have a little bit of administrative time before and after, but, and I take a 30-minute lunch break. Other than that, I am seeing patients, and I have 5 minutes in between to send prescriptions if they, so I have to have 2 people at the front, somebody checking calls and returning voicemails and checking people in and out. And then I have staff doing quick follow-ups for people who are on medical weight loss or things like that. So, I mean, I have a big team around me. I have a staff of including me, 7 people. So 6 other people on my staff. And some of them are part-time and some of them are full-time. But it takes all of that because I can't always do the marketing emails and I can't always do the, brochures. And so I have, an office manager who helps with some of those things. And I have somebody who does my social media, like my static posts. I do my own, like that. So I have a big staff. I'm ramping up my pricing.
Yes.
And I have a good location. And word of mouth has been key for me.
And you opted out of insurance as well. Let me just add that, because that, I think ultimately those of us who opt out of insurance are glad that we did, but it also makes another ramp up period.
Oh, for sure. Sure. And I think, like, I've had patients come to me because they can't get into their provider for, a month or two because they're waiting on their insurance, or they're waiting on them because they take their insurance. And they want to see me on a one-off. I don't really offer that. And I've, in the past, I've lost that boundary, but I have to stick to that. So, provide the product that you want to provide, and the patients who want that product will come to you. It's kind of long and short of what my advice would be. But yes, no, I opted out of insurance. And of course, you have to do the Medicare opt-out when you do your, licensure. In order to be like legal in doing that. So,
well, thanks for all of that. You made mistakes and you corrected also. So you don't have to get it right. You can course correct as you figure out, oh my God, I have to set boundaries. I have to do a better job with that. Like, who doesn't need to go through that?
I think like there's going to be people listening who are just like me, and that people are like, you should do a concierge medicine. And I'm like, I'm never doing concierge medicine. That's not me. And then I'm like, oh, this is so me, like,
yeah.
And I think if there's any inkling of that, go for it. And things are going to change. The scope of my practice has changed so much from when I set out doing virtual counseling people on fertility to what it is now. And I love it. It's great.
When you and I were talking offline, we talked about ways that you are streamlining your practice and, surviving. So you have this amazing team, as do I. You told me you started with Quest, and you transitioned into using Vibrant as one of your, I think, tools of streamlining, but also tools of quality. So I want to talk about how you brought Vibrant into your practice and what you're doing with them.
Yeah. So I think as I've seen the market get more and more into things like functional lab work, they want to have a breadth of lab work.
Yes.
And in the beginning, when I was, like I said, undercharging for my services, I wanted to be able to include lab work, but keep it within like a very narrow price range. Quest was helpful for that to some degree because there's no minimum in how much you can order. Some of the tests are pretty inexpensive if you set up your client account. So like a CBC can be anywhere for like $6. And so CBC, CMP, like your hemoglobin A1C, I could get a lot of labs done that were baseline for a relatively inexpensive amount, So that's where I started, and that served us pretty well. But then you're kind of figuring out, do I send the extra labs with insurance? Do I try and do it client bill? So then it just gets chaotic, and it gets hard for my staff too. So in order, like you say, to streamline it and to provide our patient base, which is really, we're following this with the market and what people are really asking for in practice, we realize we need to be able to offer more. And it is easier to be able to do this through Vibrant because they have this Vibrant America panel where you can just pick and choose any of the things that you want. So we have extended hormone testing. We have extended lipid panel testing. It's kind of like the cardiac panel, but it's not quite that extensive. And, we can get things that are inflammatory markers and a little bit longer list of the lipids, right? And so it really kind of speaks to their risk, right? Their true risk. And then, and we can add things like magnesium wasn't even in our list, or vitamin D or B12 or folate, because those things can get expensive through Quest. But when you do them all together in Vibrant, there's a minimum that you have to order for the lab work. It's $225. But as we're increasing our concierge fee and our concierge cost, and we're adding more things and more services and really getting in line with what the market is already asking for those, we're getting a more extensive lab work for $230, and our patients are much happier. And it's I don't have as many questions about who's getting what. Everybody's getting the same thing, and it's going to the same place, and it's under the same payment structure, and it's just much easier.
Yes,
and much better for clients. True. Yeah.
My clinic, or my physician who I go to, has their own custom Vibrant panel as well, and I love it. Like, I really love it, and we are talking about bringing it on when we transition into our concierge structure, because it is incredibly comprehensive. It's everything under one roof. There's no fuss, no muss, and for me as a clinician, not to have to think about the baseline tests I'm running, not to need to put any thought in that, it's just done. My team knows what they're going to get. I mean, that sounds really appealing. So I'm a huge fan of designing my own panel. And I know that you have a structure where you have people do this baseline or some sort of a modified version of that throughout the year, throughout their membership year. And I'd like to hear a little bit about that. But then you layer in, I mean, Vibrant is pretty much one-stop shopping for testing, for all testing. I mean, we use them all the time in my practice for their toxins. Sometimes we do their gut zoomer and food sensitivity. I mean, they have everything. So your panel, the original panel, do you do that in, at periodic events, or do you have a follow-up panel that's a little bit different than the baseline? And then talk to me about layering in the additional elements of their test menu.
Yeah. So the way we have it structured is that you get the same panel when you start in the 6 months.
Okay.
Now, obviously, I have patients who have like a lab abnormality. And like I talked about that minimum lab draw, sometimes we do have to still utilize Quest, because now we've found something. Like, let's take thyroid, for instance. If you're going to have an abnormal thyroid, and I'm only going to follow your thyroid, and I want to follow it at shorter intervals, it doesn't make sense then for me to always send to Vibrant. So yes, we still utilize Quest, and things are obviously, it's very individualized for patients. But for the generic, healthy, like things that aren't going to change a lot, it's every 6 months, the same panel. That makes it easy. People appreciate that. It's more than what they're getting in their primary care. It's more than what their insurance is covering. And it's covered underneath our increased tier, so that we have a basic tier, but it's covered under that tier of concierge medicine. And
they also lay it out. So you can look at trends, because I think the way that they, looking at my own data, it's really handy to have my trends over time.
It is. And then the more you order, the more discount it is. So then when let's say I just had a patient the other day, we did her basic blood work. She had a few other things she wanted to add to that, just because she was curious. And then we also had she wanted to do a food sensitivity test. And so it made that food sensitivity test a lot more affordable, because we were already in all these labs. So it is, you're right. It's like very nice one-stop shop for functional labs. There are some things you can't get on there. Like, I think, some of the genetics aren't as robust. There's probably like 4 or 5 genetic markers. But again, the ones that you probably want to test. I don't think you can get a BRCA yet. So we still have to use Quest for several things. But we do it in a way that's like very, minimal and really influenced by what we can do at Vibrant and how patients are really requesting their labs. I mean, most of what you want and what they're asking for is there.
That's awesome. Basically that the more you lay around, the cheaper it becomes. That's really nice. All right. So of the deeper dive panels, like in my clinic, when we're analyzing toxins, we'll do which is we do on all of our patients. We'll use the total tox panel from Vibrant, just all the time. And then maybe when we're doing a follow-up, we'll do a lesser. If we don't need to get all of them, we can just do a chunk of whatever, whatever abnormalities we found. But what are the ones that you're most commonly using in your practice?
The food sensitivity, people love that. The gut zoomer that shows the microbes and metabolites in there, which is very insightful for patients to kind of figure out what their gut issues are stemming from. And then we do a lot of hormone zoomer. The one issue about that is it's a urine test that you do at home. So we talked about this a little bit. Those tests they take a while to get drawn because it's on the patients and they have to type it and all that stuff. There's several samples that you have to take and you have to take them on time. And so there's a little bit of, I find if you coach them up and you kind of tell them what's going on first, they can it makes it easier for them to draw that.
Do you have your team trained in it as well? Can they support them? Okay, good. Yeah, I find that to be super essential. Or what Rhonda does in my office is that she'll tell the patient to call Vibrant, and to communicate with them, which sometimes works.
They really do have a good staff and a good team will help. And they have a lot of resources online on how to draw them. I think there's a QR code with all of the things also where it's got a link with a video and they've got a nice app. Yeah.
But to your point, that can, if it left to the patients in the patient's hands, it may be immediate or it may not.
Yeah. And I think it's more immediate, the more dire the situation, of course. But
yeah, that's right. So the hormone panel, the gut panel, anything else you're using? Oh, the food sensitivity.
Yeah, we like the food sensitivity. And then, I love the cardiac panel. That's just one of my favorite ones. And, the myco, you mentioned the mycotoxin or the total tox screen. And that's always insightful. I think, I'll weigh that with, the patient's desire to see those numbers and follow those numbers. Like you say, that it's really nice to track if you're really interested in that, with the fact that it's not going to change my management. If I think some of those things are going to be abnormal anyway, I'm going to still tell you the certain lifestyle factors that with that anyway. So
I think it can be motivating for certain patients to see those findings. It can be highly motivating to do the kind of cleanup work that we want them to do. An interesting case that I had in my practice not too long ago was a very high glyphosate. And I had them do a follow-up on that. Let's do an immediate retest. They go out to eat at restaurants. It's possible that's your exposure, because there's a lot of media on glyphosate right now, and it can be extremely anxiety-provoking. But follow-up, it was negative. It was no. They didn't have a significant burden of it, which suggests to me that they had an acute exposure in, restaurant X that they had gone out to the night before. Don't do that anymore, or know that you're going to have that transient exposure. And, that was for me, it was worth it. For them, it was worth the price tag.
Yeah. I want to do that for my husband. He has a history of cancer in his family. He he lived in kind of a food desert where there wasn't a whole lot of organic food. Yeah. And then he golfs a lot. So I take those clothes off, get in the shower,
Yes.
I mean, somebody like that, he's a perfect candidate to have.
Perfect candidate. Yes. Yeah, absolutely. I'm actually coming to mind another family that I work with who live on a golf course as well. We pay really pretty close attention to their total tox. Yeah.
Sure.
Well, this is really helpful. Anything else you've brought into your practice for that helps with the turnkey element? Like, are you working with a certain supplement company, or do you keep products in office, or how do you make that work? Just out of curiosity.
There are certain supplements that I like. I've been really vocal on my Instagram. I really have loved the parallel packets, the Peri support. Now, when you get into the methylfolate, which folate, I have some of my OB colleagues will be very consistent with, if they're in the perinatal period, they need to have true folic acid. So, and so that's one issue with the perinatal one, the prenatal vitamin. And so, and you can talk to your provider about that. Some will just recommend the methylfolate, but I really like their perinatal support. And so we see mostly women, of course. We have some men in our practice, but we're focused mostly on women. in that just after baby kind of phase in the early 40s. And I love it. It's packaged, and I'm not trying to like sell. I don't have any ties or anything. I have liked it. If I was going to do my own supplement, that's the way I do it. And I actually will, on my whiteboard in my office, I'll list like, these are the supplements I would take, and they're all in here, or most of them are in here, and I would add these few. So that's kind of how I handle vitamins. But I do think that there's opportunity for me to really hone in on one particular vitamin company and bring those in. And so that's always on our brain. And it's also, should I do it myself, is also on my brain.
That's cool.
Yeah. And then we're going to bring in a DEXA scan. Actually, we just signed on it last week. So any day now we'll have that. And that's part of that, increasing the tier and the strategic kind of giving people what they want, and, providing a turnkey kind of package where they can follow those body metrics and see their body habits change with, we do a lot of medical weight loss in our office, and we want to make sure their muscle mass is being maintained, and we want people to focus on gaining more muscle as they go through perimenopause or menopausal states. And so those are things that have really kind of helped with the flow of traffic without needing me to be the only person who can provide service.
Yes. Awesome. I think that's a huge important piece for those of us in a single provider setting is, having support, having other people in the office who can do stuff. Yeah. Now you're giving back, as we mentioned in the beginning, you're giving back to the community, which I think is huge. I think it's very impressive, because I know your plate is pretty full. It's very full. What is it? Tell me a little bit about that and why you decided to do it.
Oh gosh, I love this event. So we do an event, and we've done it annually in the past leading up to this year. We took 1 year off because that year comes fast, and you're right. It's a ton of work, but it's a beautiful event. So we're doing it biannually now to every 2 years.
Wow.
And it is, yes. So we don't make any money off of the event. Anything that we make goes to charity, and then we raise money for charity at the event. And it's usually local charities, but the first year we did a national charity on fertility, because a lot of things were happening around reproductive rights. And so, but last year we gave to a local charity that helps with providing services for homeless women and their children. And some of those are health services. And so it's been just, not only is that part great, it's actually such a vibrant thing for our community. We have anywhere from like 65 to 85 people that show up, and it's a day of speakers that we talk about health, we talk about mindset, we have sound bath meditation, yoga session, we have a breathwork session, and we have all kinds of vendors. So we have somebody who's doing cupping and ear seating, and then we have vendors that are selling goods and doing gua sha facials. And, then we had a yoga studio that's here in town. That's also kind of got a corporate setting. That's kind of nationally in different locations. They were here, and they were giving different packages out. And it is always so good when you get women together and you're connecting them in such a positive, healthy, mindset promoting way. The vibes are high. You just want to be there all the time. So we're trying to create more of those throughout the year in smaller settings, like where we just hosted a small event here in our office. Like you can see, this is my lobby.
Really nice back there.
We have furniture around. We got about 25 people in here, and we did just a little forum on perimenopause, and we had women all the way from like their late 20s into like their early 60s asking questions. And it was, everybody just left with like that, that feeling of, I've got a community here. I've got a place I can ask questions, and I can recenter myself and focus on myself for a little while. It's one of my favorite things.
I love it. It sounds so cool, Brooke. When I'm in Austin and you're doing an event, I will be there. It sounds beautiful. It sounds awesome. We did a master class for 3 days. It was virtual, but we were able to create kind of a juicy community, and we had over 100 countries represented. Yes.
I love that word, juicy. It is. It's
juicy. Yeah.
Oh, we might just have to have you come in as one of the speakers.
I would love to. I love it.
And Jessica Shepard, and she was.
Oh, she's so, yeah, of course. Yeah, that's right. Yeah, she's a badass. Well, listen, Dr. Stubbs, it was great to talk to you. Great to hear how you brought this to life, this concierge vision, your courage in actually undertaking it. I understand the need to streamline, and I love the way that you use Vibrant. I mean, we're using it in our world. I look forward to that custom panel because I think it's an important component of any concierge structure or even beyond a concierge structure. And anyway, thank you so much for coming on, joining me, and sharing your brilliance.
Oh, thank you. Thank you for having me. This has been so much fun.
Vibrant Wellness combines cutting-edge science with an integral medicine approach to give you deeper answers about your health. Their innovative testing panels identify imbalances in areas like nutrition, hormones, toxins, and the gut microbiome, so you can take targeted steps towards optimal wellness. Discover the possibilities and become a provider or connect with a provider near you at vibrant-wellness.com/signup. That's vibrant-wellness.com/signup. Disclaimer. This podcast is for informational purposes only. If you have a specific medical concern or if you have any questions, please speak with your healthcare provider.